Vibra Hospital provides long-term acute care for patients in and around the Low Country. Melanie, Floyd, and Lori Kirkendall are here to tell us more about Vibra and the services they offer, plus they're hiring.
Yes, we are.
Welcome, ladies.
Thank you.
Nice to be here.
Let's first start talking about what Vibra is. Explain.
We are a long-term acute care hospital. We actually have two separate facilities within the hospital. We're in the old East Cooper building. Most people know that from the old East Cooper Hospital, but we have a long-term acute care side, which is 59 beds focused on 20 to 30-day stays for your sicker patients, complex patients, ventilator weaning, wound care. We get the sicker patients that are in the area hospitals. So that's the LTAC side, and then we have a rehab skilled nursing side as well.
And that's where you come in. That's your specialty, right? You're the case manager.
I am. I'm actually on the long-term acute care side.
Okay, and talk about your process and what you do on a daily basis.
Okay. I'm a nurse case manager, and basically we help coordinate care between the patients and their families and the other team members. Being a nurse case manager allows for that clinical dialogue between us and the medical staff, as well as their case manager for their insurance, to make sure that we're meeting their needs and we're optimizing the benefits that they provide.
How does this differ than a regular hospital stay? Like, what part in the process do they come to you?
That's a great question. We get probably 95% of our patients from area hospitals, the MUSC, Trident, Roper, St. Francis, East Cooper. Those hospitals are discharging to us because the patients need more care, but the hospitals need to get them out and to a better place to get longer care. And so, like I said, if excuse me, if we have a complex patient that needs IV antibiotics, extensive wound care, really complicated patients that need 20 to 30 days more care, then we can help care for them and get them to a place where they can go back to where they were before, back to their home, back to their assisted living, wherever they came.
So you take health care. It's just like a hospital, but there's certain criteria that the patients have to meet before they can get admitted.
Absolutely, absolutely. And part of that is like a wound that's severe. Okay. And really, when a lower level of care fails, they are not able to care for a certain type of situation, more than likely we can be. And we have nurse liaisons out there that evaluate patients on a daily, hourly basis to see if they meet criteria.
So you guys are hiring. How do you need help? What positions are you hiring, and who can apply?
Mainly nurses.
Okay.
We are looking for LPNs, RNs, CNA positions available. If you go to our website, vhcharleston.com, you'll see a place where you can apply right there.
So how many staff are employed at this hospital?
We have about 250 here. We are nationwide, but we're the only one in South Carolina. So we have about 250 employees currently.
And what's the mission statement of the hospital?
Our goal is to get patients back to where they came from. We have had patients that have come into our building with very little hope, a very sad prognosis, and had them walk out. That's what makes our job so wonderful and so fulfilling, is taking the sick of the sickest and getting them back to their lifestyle as best we can. Is
this like any job you've ever had before? Is it a different mindset for you when you go to work every day?
Absolutely, absolutely. I think, you know, from my perspective as a nurse case manager, just thinking about discharging, just thinking about making sure that we're open and honest and there's no surprises. That, you know, you're talking about patients and families that have been through a lot before they actually get to us. And just watching their progress and providing that care that's needed at every level is very important.
So where can they go to apply? How do people know where to send their application and their resumes?
Our website is vhcharleston.com, and you click on careers and you see everything that's available and you apply online.
Can it be doctor's office nurses, hospital nurses? Does it matter what kind of nurses?
We really prefer nurses with acute care. ICU experience is a plus just because we have very sick, complex patients. So the more experience they've had, the less surprise they will have when they're caring for patients.
And is it just patients from the local area, or do you get some from out of state?
No, we get them from out of state. We get them from everywhere. A lot of times people will be vacationing somewhere and they've got family here, they want to return home, or they want to be close to a family member, so we get them from all over the country.
Excellent. Thank you ladies so much, and keep up the great work, and let's get your staff up to par.
Yes.
Everybody get it filled.
Yes. Thank you so much.
Sure, thank you. And stay with us. We're back in a moment.